I'm gonna start off by washing my hands and introducing myself. Hi, my name is Ahmad. I'm a student family nurse practitioner at United States University. I was wanting to get your consent for a musculoskeletal exam to upload to YouTube for my instructor to grade. Alright, perfect. I'm gonna start off by inspecting your head and neck. I'm gonna be inspecting it for symmetry. Okay, both of your head and neck. For any deformities, any abnormalities. Your head is normocephalic, it's symmetrical, and your neck is symmetrical. Okay, next I'm gonna palpate. I'm gonna palpate your jaw, test up for some TMJ, okay? So I'm gonna have you open, you close your mouth a few times, open, close. Alright, good job. Okay, nothing over there. Okay, next I'm going to palpate your trapezius. When I'm palpating it, I'm going to be palpating for any lumps, masses, any nodules, any deformities. So that's when I'm palpating, that's what I'm usually looking for, okay? So I'm going to be palpating your trapezius. I don't feel any abnormalities. I'm going to palpate your rhombus. Okay, I don't feel any abnormalities, okay. And then so next I am going to test out your range of motion, okay. First I'm gonna do your jaw. I'm gonna have you open and close your jaw real wide. I'll close it, good job. I'm gonna have you open it and move it around. Awesome. Open it and move it side to side. Okay, good. So range of motion is fully intact. Any pain or anything? No. Okay, good. Next, I'm going to have you turn your head to the right, to the left. Okay. Look down. Look up. Look up. Okay. Your ear to touch your ear to your closest shoulder, to your other shoulder. All right. Range of motion was tested for her cervical spine and neck, laterally. Rotation, medial and lateral, and range of motion was normal. All right, next I'm going to do a specialty test. This is a cervical pressure test where we put a bit of compression on your neck. If you feel any numbness and tingling, it's a positive test, okay? So I'm just going to apply some pressure on your neck, okay? Any pain or anything? Okay, awesome. Next, I'm going to inspect and assess your shoulders. Looking at your shoulders, I'm looking to see if they're symmetrical, and your shoulders are both symmetrical. I'm looking for any redness, edema, nodules, any of that deformities. I don't see any of that, okay? Next, I'm gonna palpate your shoulder, and when I'm palpating, I'm gonna be palpating for any nodules, masses, deformities, abnormalities, okay? All right, and I'm gonna be palpating your acrovicular scapula right here. All right, your greater trifecta of your greater humerus cervical up here. Okay, your humerus grove. Okay, looking at your shoulders, palpating that. Okay, next I am going to have you. I'm going to have you do some range of motion. I'm going to do some range of motion exercises, okay? I'm going to have you raise both of your hands laterally. All right, forward, back down to your side, forward and up. All right, and then adduction, abduction. So shoulders like this, rotate upwards. All right, good job. And then I'm going to try to touch the back of your head with your hand. All right, good job. And then we did to your side and all the way up. Yeah, all the way up. All right, range of motion is present, fully in flexion, extension, lateral, external, and right now we are going to do a specialty test, which is called the empty can, and this test helps us identify if you have any rotator cuff muscle issues. So I'm going to have you hold both hands straight out with your fingers down, and I'm just going to apply pressure and just hold it up and resist, and when I let go, let me know if there's any pain. Any pain? All right, good. So empty can test was negative. There was no pain anywhere in her rotator cuffs. All right. Next, I'm going to Next, I'm going to inspect your elbows. I'm going to be looking at your elbows symmetrically. I'm going to be looking for any deformities. Your elbows are both symmetrical. All right. Next, I'm going to palpate, and when I'm palpating for any nodules, masses, any deformities, anything non-present. And now I'm going to palpate for your olecranon process, which is right here. And then with your elbow, I'm gonna, indicate two areas that are more common for injuries, which is going to be tennis elbow and golfer's elbow. And then usually the tennis elbow is usually located in the, you have the lateral and the external trochantars, and that's where the lateral one will be the golfer's elbow, and the medial one is usually the area where tennis elbow is usually present. Okay. Next, I'm gonna do the Fallon and the Tennel test. This one I will have you do two tests. One, I'm gonna have you put your hands up against each other like that and put pressure, and usually I'll have you hold that for 60 seconds, and then after 60 seconds when you let go, if there's any pain that pinches your central nerve, you could let go, that's okay. That pinches your medial nerve and you would feel numbness and tingling. The second test is going to be, I'm going to be tapping on your medial nerve repetitively, and this will if you start feeling any numbness and tingling, that would mean a positive test, which right here we did not have any of that, which is negative findings, which is what we want, okay? So I inspected, I palpated your elbow. Okay, next we're gonna do the range of motion for your elbow, okay? I'm gonna have you hold your elbows out, elbows up, in, back out, okay? Rotate, rotate. All right, good. So your range of motion is fully present in your elbows. Okay, next I'm gonna check out your hands and wrist. Okay, I'm gonna start off by inspecting your wrists and hands for any deformities, abnormalities. I don't see any in your hands or wrists. All right, next I'm gonna palpate. I'm gonna start off by palpating your hand and fingers. I'm going to palpate the distal and lateral interphalanges, and then your metacarpal phalanges. Any tenderness, any pain? No? Alright, next I'm going to palpate your hand, your tarsal and your metatarsal muscles. Any pain? Okay. Next I'm going to apply pressure on your radial and ulna. Any pain? No? Okay. Let me check out this hand. Alright, so I palpated both hands bilaterally. There is no masses, no lumps, no tenderness, no nodules. All was normal finding. Alright, next I'm going to test out your range of motion. I'm going to have you make a fist, open it up, abduct your fingers. Alright, and then I'm going to have you touch each finger with your thumb. Okay, and next I'm gonna have you have your hands out straight and move your wrists side to side. Okay, and then up with your fingers up and down. Okay, I tested out her range of motion and her wrist, external and internal, laterally and medially, and pronation and supination. Range of motion was present, no difficulties, as well as range of motion was present in all 5 fingers as we just noticed. Okay, next we are going to go from hands. Next we are moving down to the spine. All right, I'm gonna have you stand up for this one, please. All right, I'm just gonna assess, your posture, your spine, stuff like that. All right, maybe if you want to turn towards the camera that way while I assess some things. Okay. So looking at you, okay, I'm looking at your posture. Your posture is symmetrical. Okay, I'm gonna inspect your posture. Okay, I'm gonna have you try to touch. I'm gonna check out your range of motion and just check out if you have any kyphosis, lydorsis. So kind of try to touch your toes a little bit while I check out. All right, go ahead, stand back up. Any issues?
No.
No issues. Okay, good. Okay, you have a seat right here. I'm gonna finish inspecting your spine. Okay, looking at your spine. I don't see your posture is symmetrical. I don't see any deformities. I did not notice any scoliosis. None of that. Okay. Next, I am going to palpate. I'm gonna palpate your spine and your discs for any tenderness or pain. So you let me know if you feel anything, any pain.
No.
All right. Next, I'm going to percuss over her spine with my hand, palm, and fist. All right. Any pain?
No.
Any pain?
No.
Any pain?
No.
Any pain?
No.
No. Okay. Cool. All right. So I percussed her back, starting from the top to the bottom. There was no tenderness, no pain. Normal findings. Okay. Next, I'm gonna test out your range of motion. Okay. This usually I'll stand behind you, and I will hold your hips in place, and I'm gonna have you move laterally to the side 30 degrees. Yes, good, and then back straight, and then to the other side. Nice. All right, back straight. Then I'm gonna have you bend your back backwards towards me. All right, back straight. And then I'm gonna have you rotate to the left, yep, and then rotate to the other side. All right, any pain, difficulties, or anything doing any of that?
No.
All right, good. So for her spine, range of motion was fully intact. Patient was able to bend backwards, forward, as we assessed earlier, without any difficulties. Full range of motion in her spine. All normal findings. Okay. And then after the spine, we are going to assess your hips. So I'm going to look at your hips. I'm looking for any abnormalities. So I'm looking for some symmetry, and your hips are symmetrical. I don't see any edema. I don't see any swelling. I don't see any masses, any nodules. Okay. Next, I'm going to palpate your hip. Palpate your ACES muscle, which is right here. And then back here will be your superior, the opposite of the anterior ACES that we were talking about. Okay, and when I'm palpating your hips, I'm palpating for any lumps, any abnormalities, any tenderness, which I do not see anywhere. No dip, no tenderness, no pain anywhere in your hips, correct?
Yeah.
No? Okay, cool. All right, inspected, palpated. Okay, next I'm gonna have you lay down on your back. I'm going to test out your hips. I'm gonna do your range of motion test. Okay, first I'm gonna have you bend your knees up 90, just like that. Yes, all right, good. And then lay it flat. Okay, raise your legs up. All right, good. Lay it back down. Okay, perfect. Okay, right now I am going to make sure the camera's over here. Okay. Next, I'm going to test out her range of motion, active and passively, okay? I'm going to raise this hip up. Okay, just relax. All right, I'm going to adduct it 30 degrees. All right, and then I'm going to abduct it 60. Okay, perfect. Range of motion is present in the left hip. Now I'm going to try with the right hip. All right, passively. Okay, I'm going to abduct. I'm going to adduct it. Okay, relax. All right, now next I'm going to have you raise each one on your own. Okay, and the other one. All right, and right here we're going to do the specialty test, which is called the leg raise. I'm going to raise your leg, and I'm going to hold it for a while, and then after I let go, if it feels tired, you be positive for that, okay? You could lay it down. Any fatigue? No? Okay, good. So patient range of motion is present. No crepitus, no pain, no difficulty with rotating, so all normal findings, okay? Next, I am going to assess your knees, so I'm going to have you sit back up if you don't mind. Okay, this one, let's make sure we're in view. Okay, so for the knees, I'm just going to have you raise your knees all the way up if you can. Okay, that's actually one of the tests. If you lay back down, if you could lay back down, one of the tests that I wanted you to test out for your spine is hold your leg up to your chest, just one leg. Okay, it's okay, and then relax the other one, and then while you're doing that, if you feel any pain, do you feel any pain when you're doing that? Alright, so that's negative for that test. So for your legs right now, I'm gonna have you raise it up and down like that for me, okay? Oh no, you're okay, just make sure you're in camera. Okay. Alright, so first I'm gonna start off by inspecting your knees. I'm looking for any deformities such as the two common knee deformities. So there's usually two common knee deformities. We usually inspect the legs for those, and right now I don't see any deformities. There's no abnormalities. Your knees are both symmetrical. It's all within normal limits. Okay, next I'm going to palpate your knees. Okay, so I'm gonna palpate. And when I'm palpating your knees, I'm going to be palpating for any tenderness, any lumps, any nodules, any masses, any of that stuff. Any pain? None? Okay. So no pain indicated in both knees. Okay, next I am going to assess your range of motion. Do you mind raising your legs up for me like how we were saying? Up, and then down. Okay. And then I'm going to have you lay on your back, and I'm going to do a few tests on you, okay? So range of motion is present in her knees. Next, I'm going to assess her range of motion. I'm actually going to do some specialty tests. I'm going to do the Bears test, the Vegas test, which we're going to be testing out the ACL, the MCL, the McMurray test. We're going to be testing out the ACL, the MCL, the LCL by abducting, rotating the knees and the ligaments. All right, so the first one we're going to do is the Bears test. Ankle and knee, abduct bilateral knee. Okay, no pain. Next, I'm going to do the biggest test, which is the opposite. Okay, any pain? No. Okay, next I'm going to do the drawer test. Okay, so I'm going to put my feet on your knees. Let me grab your tibia and pull. Any pain?
No.
No, okay. And then next I'm going to do the McMurray test. So I'm going to put your leg out like this. Rotate it. Any pain? No, okay. You can sit back up. Patient specialty test was performed on the patient. Patient denies any pain in her ligaments, in her meniscus, her ACLs, MCLs, LCL. Everything was intact. There was no tenderness, no pain, no crepitus. All normal findings. Okay. Next, I am going to inspect your foot, toes, and heel. So I'm gonna have you sit back. See, I'm gonna get this on the camera. Sit back so I could, if you want to lay back, so I could. All right. So first, I'm gonna start out by assessing your ankle. I'm gonna be inspecting your ankle. Okay, looking for any abnormalities. Usually, I'll have you standing up to look for any deformities in your feet, such as flat feet, but that's just for information. So I'm inspecting your ankles, looking at them bilaterally. I don't see any abnormalities. I am going to palpate your ankles bilaterally. Any pain, tenderness at the Achilles or the gastroc area? No. Okay, next I'm going to have you range of motion for me. If you could raise your leg up and plantar down, okay, and around as well. All right, same thing with the other leg. Okay, perfect. Patient is able to plantar foot, rotate external, lateral, and medial. Range of motion is fully intact. Next, I'm going to inspect your foot. I'm looking at your foot for any bunions, for any deformities, nodules. nodules. So these are things that are usually very common on the foot. So I'm going to be inspecting, looking at your feet for any of those. Okay, looking at those, I don't see that anywhere. Okay. Next, I'm going to palpate your tarsals and metatarsals in your foot, feeling for any deformities, any nodules or masses. I don't feel any. Okay, next I'm going to palpate your toes, your interphalanges and distal phalanges for any tenderness, for any nodules, any pain, no pain? No, okay. Next, I'm going to assess your range of motion. So if I could have you curl your toes in, curl your toes out, okay. Curl them in, curl them out, okay. And then we're able to raise your foot up and down completely, okay, and rotate it, okay. Okay, good. So range of motion is present. Patient is able to plantar toes, flexor and extensor toes. Skin is intact, no abnormalities, all normal findings. Okay. And then what's your special test for? And I think that concludes our exam. Thank you.
Thank you.